Now to a controversial treatment for a disorder that affects thousands of Australian children and their families. An American mother has started managing her son's severe autism with medicinal marijuana. It was an act of desperation when young Joey's weight dropped to just 20 kilograms. But since taking marijuana-laced chocolate a couple of times a week, the 12-year-old is thriving.
Everything has improved. Right now, he's given one brownie every 2 to 3 days.
Okay.
Whereas the other medications he was taking every single day, twice a day.
So, is it a legitimate treatment option or far too risky? Sunrise medical editor Dr. John Darcy joins me now. Good morning, DJ.
Good morning.
Now, we've spoken to a specialist in this area who suggested that marijuana could be helpful in treating the high anxiety felt by many sufferers of autism. Would you agree with that part of?
No, I definitely agree with that part. The other side of its great benefit is that that little boy was starting to eat, and if you eat marijuana, you get if you use marijuana, people, because I don't, they have the
munchies.
Munchies, right? Now, so indeed, isn't it interesting that she's chosen to increase his weight by giving him that, and has found that he's much better with his anxiety, etc.
Yeah.
Can I tell you a story?
Yeah, please do.
We've got a part of our brain which they call the cannabinoid brain.
Right.
Now, cannabis is marijuana, so it's marijuana-like or reward part of our brain.
Oh, okay, yeah.
If I was to show you a pretty picture of a smiling face and then to measure the chemicals that were going on in your brain in the cannabinoid area, they'd light up.
Gotcha.
And they've got good science to prove that. So what seems to be happening with these little autistic children and young people is that by giving them, not legal, illegal often, marijuana or cannabis, you may be increasing the biochemical activity in that part of the brain they call the thalamus. So there could be some very strong science behind this, and we're just seeing it because mum's doing it.
Well, part of the problem with autism, of course, is that sufferers don't respond to the regular social stimuli.
Exactly.
So there's no relationship often.
That's why the smiling face. If I show you that, if mum says, "Hi, how are you?" smiles, then the natural response one hopes from a child is say, "Hi, mum, how are you?" And so by showing the smiling face and seeing this cannabinoid area lighting up, it may be that there's good science behind it.
So it may be that the cannabis is heightening the response of that area of the brain.
Biochemically.
It's a legal minefield.
It is. It is. Well, cannabis in some states of the United States of America is used medicinally. It's not strictly used medicinally here. People do because it's very widely available. And, with HIV, it was encouraging eating with people who have really bad pain when you don't know what's causing that pain and it's coming from the nerve itself. They call it neuropathic pain. It does show great benefits in that. And also anti-nausea and chemotherapy when people are having cancer drugs. The use of cannabis can sometimes help that. So, yeah,
although the effects of cannabis on the population at large vary greatly from person to person.
And so they do.
One would imagine it was quite the same with autistic people.
Well, that's exactly right. And that's the reason why a doctor can't say, well, it's a good idea.
Yeah.
But we're interested in it. If it is happening, we're interested in it. And there may one day there will be one day the science to prove it yay or nay.
Indeed, indeed. Well, that's what Monique is hoping for. I think she's been over-prescribing her cat, actually.
Well, I think that cat definitely looks like it's had cannabis.
Yeah, certainly it's cannabinoid.
But that wouldn't be coming from Monique. That would be from some other place.
All right, Dr. John, thank you very much for that. Cheers.
Pleasure.
Over to you, Moni.
See, teenagers, he'll get up to anything, that cat. I don't know what he's up to, but there's a medical opinion for you. All right, thanks, Andrew. Thanks, Doc John.